Uh, so there we go. Thank you so much, all of you, for joining this program. I welcome all of you to the batch 14th of Master Trainer program. I really appreciate your effort and interest and also trust in the program. And I assure you, once we complete the program, we all will be very, very happy because this is what the feedback I have received from people who have attended it. And I hope with your cooperation, with your participation, with your engagement, definitely it will be a very rich learning for all of us. Before I go further, I think I would like to do a bit of technology reminder for all of us because I know we need to really remember. Although all of you are very senior in your positions and you already know the code of conduct, but just for kind of a reminder for all of us so that we keep in mind uh, the uh, the uh, the the code of conduct that we need to follow. So let me quickly share one slide with you and take you to the technology reminder. Give me a second, please. I hope you're able to see my screen.
Yeah, it is showing loading.
Yeah,
Loading.
little slow. I don't know the reason, but then anyway, yeah. Okay. So my first request to all of you is to join using your laptop so that you can see everybody and you can also see everybody in a broader picture and also have your video on throughout the session. See, online programs have its own limitation, but my experience and my learning in the last couple of batches have been if you keep your video on, you will be engaged totally because we need to be be visible to others and also should be seeing others to stay engaged. And therefore I request all of you to have your video on. Especially it's not going to be any theory session or anything that I'm just going to show you a presentation and you just listen to what I say, but it's going to be a very interactive hands-on training. So throughout the program make sure that you have your video on. And therefore in the email I sent this message that please sit at a place where you can comfortably keep your camera on and you can talk and you can discuss and ask questions and there should be no disturbance around you. And that's why I sent that message in the email very particularly that make sure that you sit at a comfortable place where you can keep your video on all the time. We all normally keep the view on the gallery view so that we can see each other. That will help us to interact with the members freely. Keep your device on the mute mode, and whenever you want to speak please unmute your device and you can speak. There is no restriction or speaking because all of you are very senior people, so I don't want to stop you from talking, but then otherwise I know we are at home, so naturally there will be some sound from the kitchen or from the dining area. So therefore please keep your device on the mute mode, and whenever we need to talk you can always unmute and speak. If you're moving from one place to another, if you're changing your place for some reason, please stop your video and then you can move to the next place and then have the video on. And also at the same time, a lot of prompts will come to your chat box. Keep an eye on the chat box. You will have to respond in the chat box and a lot of messages will be there. So you have to keep an eye on the chat box also. Make sure that you rename your login ID with your proper official name so that we know each other. Of course, after a while, we will know each other very well. But at least to start with, it's important to know who is who. So please have your official name on your login ID so that everybody can see each other. So certain relational group agreement that I want to again revise for all of us so that we remember that this is the code of conduct we all will follow. Again, it's a reminder, please, no restriction or no such direction. See, as I said in the email and also now, it's active participation. That's what is going to bring learning to all of us. So I request each one of you to actively engage, ask questions, Give answers. If you don't understand, please clarify. If you don't agree, you have the right to express your disagreement and discuss, so that group can bring in more perspective and better understanding. So make sure that you stay actively engaged and you participate in the program. I know all of you are very experienced and everybody is very learned here, and we are here to learn. So it's very difficult to stop yourself from sharing what you know, but at the same time, we have to remember that there are others with us. Especially these programs are a mixed group of doctors, nurses, administrators, and people from quality, and also other healthcare categories. So we have to be mindful of others' presence. The benefit of having a mixed group is that you get to see each other's perspective very closely, and a lot of challenges that we are facing in our own arenas, we are able to discuss in a more safe environment where people can give their opinion and ideas and suggestions. But at the same time, we have to make sure that we are respectful towards each other and we don't hurt or disrespect anybody. Give everyone a chance to contribute. Some of us are very good speakers, some of us have challenge in expressing. I would respect everyone. I would also say, in case if anybody has challenge with language, if you are comfortable speaking Hindi or language that you think helps you express better, which everybody can understand, feel comfortable to speak in Hindi or the language that others can understand. But you must participate, and we have to give chance to others also to contribute. A lot of time, members will come up with their situations that they are facing in their workplace, and it otherwise may not be very comfortable to share with others. But we have to remember, what we will discuss here will remain confidential and it will not be discussed or used later on after this session. Lot of opportunity will come for you to give feedback to each other. So make sure that you start with strengths, because we have a tendency to look at the weaknesses and find faults. But very mindfully, you have to train yourself to focus on the strengths, because that is where everybody will become comfortable and feel psychologically safe. So for that, we have to stay, non-judgmental and be very specific about any feedback that you wish to give to each other. I know I have interacted with many of you on various platforms, and with some of you, I'm meeting for the first time. And I also understand it takes time to develop trust, but I'm very sure that in a while, we all will be very comfortable and we will enjoy the journey together. It takes time to earn the trust. And also, you are meeting me for the first time, so I'm sure you will be skeptical about my ability or my knowledge or my understanding. I am one of you. I will be learning while working with you. So and that trust will come with time. I will be very patient, and I request you also to be patient on that front. During the program, I request you to keep your phone on the silent mode. Avoid taking phone call. Normally, I do not take any phone call unless it is urgent. If it is very urgent, please keep it very short, and also make sure that you switch off your video while attending the call. Otherwise, I think we all know this. I don't think I should be, talking more about it. Again, before going further, I would like to start with the introduction. Although I'm sure detailed introduction will keep happening, because when we will interact with each other, there'll be a lot to talk about self. For this particular activity, I would keep the introduction I would request you to keep the introduction short. So we will speak only for 60 seconds. Each one of us will speak for 60 seconds and tell about self. So what you have to tell your name, your designation, whichever organization you are coming from. It'll be nice if you can tell something about your name, what you value about your name, and then pass the baton to the next person. So I think I will take the lead. I will start with the introduction and I'll pass the baton to one of the participants, and that way we will have, introduction on all of you. So I honestly want to spend very little time on introduction right now, so that we can give more time to the session. But of course, we will have more opportunity to interact and introduce and take introduction from each other. So I'm starting my introduction. I would request somebody to time it, and we will time everybody's introduction. So that's also an art. We have to learn to, be very specific when we speak. So I request can somebody take the responsibility of being the uh, timekeeper? Anybody? Aparna, will you do? On your
Sure,
phone,
ma'am.
you can have the timer. Okay. So should I start?
Yes, ma'am.
Okay. So friends, I'm Dr. Indu Arneja. I'm a psychologist in private practice. At the same time, I founded this organization called Indian Institute of Healthcare Communication with the idea to, help healthcare professionals with their communication and interpersonal skills. For the last 30 years, I'm in the field of training. For the last 10 years specifically, I am in the field of healthcare communication and I'm trying to work on this skill. I'm working with a couple of medical colleges and a lot of hospitals. I may have done around 2000 programs in the last 10 years where I'm interacting with various categories of healthcare professionals and helping them learn their communication and interpersonal skills. I'm a visiting faculty to some of the very prestigious organizations like IIM Ahmedabad, XLRI Jamshedpur, Delhi Judicial Academy, Maulana Azad Medical College, and many more. So I would say God has been very, very kind to me to have given me this opportunity to work in this niche area. So the idea of Master Trainer program came to my mind because I felt I wouldn't be able to reach everywhere. So I really want to create my clones.
So,
I'm
ma'am, you have exceeded 60 seconds.
Thank you for reminding. Thank you.
Okay.
Last one
Okay.
second. This is one book I have written. I'll share the link with all of you. I wish I could send a complimentary copy of this, but if you can buy this from Amazon because it is very normally priced, just 300 rupees. It has beautiful content, keeping Indian healthcare delivery system in context. But I'll talk about it later. Thank you, Aparna, for reminding. So I pass the baton to Dr. Purnima to introduce herself. Thank you.
Very good evening to all. My name is Dr. Purnima Purohit. Please excuse the hoarseness of my voice. I have a very bad RTI right now. I have held the post of pediatric in charge at Mumbai Port Hospital for close to 25 years. And then I have retired from the Ministry of Ports, Shipping and Waterways at an early age of 53 as a chief medical officer, where I served in the port at Tamil Nadu. Currently, I am only involved in social initiatives and voluntary health advice and coaching as and when opportunities arise. Thank you.
Thank you so much, Dr. Purnima. Thank you. Whom do you want to pass the baton?
I think we can go with Soma, who is next to me on the screen, and Aparna also.
Sure, sure.
Yes. Good evening, everyone. I'm Dr. Soma Ganesh. I'm a senior consultant in anesthesia at Sri Ramachandra Medical College and Medical Center, Chennai. I'm passionate about medical education, teaching, and I'm involved in simulation training to my undergraduate and postgraduate students. I think this program will be of immense benefit to me, for me to help my students to communicate with each other and with patients much better. Thank you. I would like to pass the baton to Aparna.
Okay. Hi. Hello, everyone. Hope I'm audible.
Yes, you are.
Okay. Yeah. Hi. So, my name is Aparna Awasthi, and I head the quality department at Bhatia Hospital, which is in South Mumbai, and I've been working there for the last 4 years. And recently, our hospital went through the full NABH accreditation. So things are going on. Non-compliances have come in, and so this is busy with days are busy. So I'll just pass on my. I'll pass on to Mrs. Raminder Kalra, madam.
Yeah, good evening, everyone. I'm Dr. Raminda Kalra, a nurse with more than 38 years of experience, presently working as principal cum professor in Holy Family College of Nursing. And for nurses, I've done a lot of sessions on communication, but I feel I need to go further in that. Thank you. And I further pass on to Dr. Bijoy.
Thank you, Raminda ma'am. My name is Dr. Bijoy. Hi, everyone. I'm from Kerala. I'm currently working as a special officer in Mother and Child Hospital in the place of Talasheri, Kerala. And I'm also an NQS, National SSR as well. right now, from a clinical point of view to more teaching point of view, I think I have a lot of things to learn from this program. So I hope this will be very much useful to me. So looking forward, I'm very much excited actually. So thank you, everyone. Now I like to invite Dr. Anu to introduce.
Thank you, Vijay. Thank you so much. This is Dr. Anusha, working as a clinical educator in GVK EMRI, and I'm in this field from last 15 years. I'm a certified AHA instructor and AAFP instructor. So communication is very much like I'm very much interested to know about this patient communication. So I was in talks with Dr. Indu from so many, I can say from last 1 year. So I want to learn more about this because I will be mentoring some medical students in my profession. So I want to change this patient communication from my side. So this is like very much excited to know about these things, ma'am. Thank you all.
Thank you, Anu. Whom do you want to nominate after you?
Now I want to nominate Dr. Sambhaji Garat.
Thank you. Good evening, everyone. Myself, Dr. Sambhaji Garg. Basically, I'm an anesthetist. I'm working in a critical care. Presently, I'm working as a chief intensivist at Bhatia Hospital, Mumbai. I am there in critical care since last almost 20 years. Thank you.
Thank you, sir. So whom do you want to nominate after you to speak? So friends, here I must also make a mention. We have Dr. Razak from Bangladesh. I mean, for all my programs, I've always been having some, neighboring country nominations. And I mean, there are a couple of doctors who have already attended this program. So Dr. Razak this time contacted me and enrolled for the program. So I would be happy if Dr. Razak introduce himself and then maybe he can pass the baton to others. Yes, Dr. Razak, please go ahead.
Yes, myself, Dr. Abdul Razzaq Khan. Assalamu alaikum and very good evening to all. I am from Bangladesh and in Chittagong city, a very healthy city in Southeast Asia. And my meaning is the slave of Almighty Allah who gives us wealth and fooding. And I am working in a medical college hospital as a deputy director. And I love to take part in training session and also teach others. And I think healthcare communication is a vital role in my profession and as well as also for the clinician and as well as all other healthcare professionals. Thank you very much.
Thank you, Dr. Razak. Yeah.
Thank you.
So who is next? So I can see Babu Ibrahim. I'm sorry, I don't think this is the...
Hello.
Yeah.
Myself, Simil Babu.
Okay.
Actually, identity is coming differently.
Okay.
Myself, Simil Babu, working as vice principal in Holy Family College of Nursing in Delhi. And I have completed my PhD. And I have around 18 years of teaching experience and 13 years of clinical experience in nursing. Teaching students, nursing student, BSc nursing, MSc nursing, and GNM, and different levels of nursing students we are teaching. Looking forward for a lot of improvement.
Welcome.
Yeah.
Welcome. Thank you. Thank you. So, Dr. Abhishek, I request you to introduce, and then I'll ask others who are not visible. Yes.
Hello. Good evening, everyone. I am Dr. Abhishek Subhash. I am a consultant in internal medicine and I'm practicing at Bhatia Hospital. I've been at Bhatia since past 8 years and almost 10 years of total experience in internal medicine. So looking forward to this wonderful program. Thank you so much.
Thank you, Dr. Abhishek. So I think Anandita is there and Raminder, Miss Jenna is not here.
Yeah, I am there. Myself, Anandita.
Anandita, I mean, can you please have your camera on?
Yes, so I have been facing a problem. So I
Mhm.
mentioned in the WhatsApp group there's some technical issues for which I'm not able to switch on. I mean, I have put the it in the video mode is on, but still, however, I'm not able. I can neither can be seen. So that's the
Yeah,
issue that I'm trying to figure it out. So
yeah.
apologies for that.
Okay.
So
Okay.
a little bit about myself. My name is Anandita Bhattacharya. The
Mhm.
name means one who doesn't have any ninda. So I ensure that there is always praise related to me by my work, by virtue of my work and my other credibilities. And I have total years of experience, working experience as 22 years. I am currently heading Hinduja Hospital Khar in the HR department, head of human resource department. And out of 22 years, 12 years exclusively into hospital industry, healthcare industry. And I take active part in the training programs. In fact, I take care of the soft skill part of the training part from the HR that is being taught. And effective communication is one of my favorite as well as most frequent topic that we take care. So that's all
Thank
about.
you. Thank you, Anandita. So, Anandita, for today, in case if you think joining from mobile will help you,
I'll try.
You can join from mobile.
Okay, I'll do that.
Sure,
Thank
sure.
you.
So I could see Jenna's message. Jenna, if you're there, if you could introduce yourself, that'll be nice. Jenna, are you there?
I think Jenna sent a message in WhatsApp saying that she won't be able to unmute or turn on the video this time. So she's
So
asked
Jenna, do you think
to
you want to join? Yeah. Jenna, do you think you want to join using mobile? It's okay.
Left message in the chat.
But she sent a message?
The chat box, yeah.
Yeah, she said she's not able to connect. Yeah. So one more announcement that I want to make here. By the time Jenna and Anandita try to join using mobile, I know it's late evening hours. So in between, please feel free to take tea, coffee, water. There's no restriction to that, because I know after a day long, once you come home, you're tired and you want to replenish your energy. It's perfectly all right if you're having tea, coffee, juice, anything. Even during the program, it's perfectly comfortable. So I think most of us have introduced. Anybody who is still left, if I missed anyone?
Mr. Vijayaraj sir is left.
Yes. Yes. Sir, if you're there, if you could have your camera on, it will be nice. Ananta, are you able to have your camera on now?
I'm
yes,
trying.
Sir. Okay. Anandita, you will have to actually log out of the laptop, otherwise there'll be echo. Vijay sir, can I request you to introduce yourself? Please unmute your device.
Can you hear me, Dr. Indu?
We can.
Yeah, I'm Vijayaraj Manuel. I'm the CHRO of Bhatia Hospital. And I'm very glad to join this program on communications. I'm yet to learn a lot of things. Thank you.
Thank you so much, sir. Thank you. Thank you. I think most of us, Lavanya, are you there?
I am visible now.
Yeah, Anandita, thank you for you're using mobile. That's okay. Perfectly.
Yes. Right now I'm using the mobile.
It's all right. Lavanya, are you there? So there are two participants from the last batch. And the reason they are here is because some of their requirements they had not been able to complete. And that's a message for all of us that to claim your certificate, there's a requirement that you have to attend all the sessions. And also there's a small assignment that I ask everyone to do. You will have to do that before you can claim your certificate. But of course, certificate has no value unless you actually genuinely learn and are able to, showcase that in your work. Even if you just say that I'm associated with IIHC, and I'm working with them, and I know that will be good enough, but then that your work should speak for you. And therefore, this requirement that you have to attend all the session, and also a small assignment that I give. So taking further from here, I want to give you a brief overview of the program before I start talking about the first topic. So first of all, let me tell you the purpose of this program. Although I have written it very clearly in the email, the idea of this program is first of all to empower all the participants with deeper understanding of essential communications in patient care. Normally, we think it's about niceties. It's about being good and nice and soft skills that we talk about. Honestly, if you ask me, if somebody says healthcare communication is soft skill training, pardon me for this, I really do not like the comparison. You will agree with me once you will attend the session, once you will have a look at the list of the topics that we are going to cover. Yes, soft skills, niceties, they are part of healthcare communication, but that's not the whole. That's just small part of it. So you will get actually deeper understanding of what exactly is healthcare communication. That's one of the primary objective. And the second idea is that I want the participants to go back with deeper understanding of how to deliver this to others. How do we really, help people learn it? So again, as I said, it's a master trainer program. So I expect that either you will be training, even if you are not training, at least you will have deeper understanding of how do the training happen. Even if under you, if people are training, you would know this is how the training will be successful, meaningful, and will actually happen. So the specific objective of the program is to create deeper understanding of the program, learn how to develop and deliver a successful program. And once I will tell you the outline of the complete program, you will actually understand that how we are going to focus on it. And then also at the same time, the best part of the program is that we are going to learn excellent pedagogies that can be used to deliver and engage your audience. Those who are already into training, you will agree with me, the biggest challenge is how do we make people sit and participate, isn't it? So during this program, through this program, you will go back wonderfully empowered with various pedagogies that can not only hook your audience, but also make them interested and motivated. That's my promise to you. The whole program has been designed in this manner. So the focus of the program is one, of course, is on content. So the topics that you will see would cover most of the primary content that you require for healthcare communication. Besides that, I've sent you a soft copy of a course material. Once you will have a look at it, you will get idea about various topics. And as I said earlier also, if you can catch hold of this book, buy this book, read this book, you will get to a lot about healthcare communication, because very in detail I have talked about how do you communicate with patients of various, uh, types. For example, with elderly patients, with pediatric patients, with patients with visual challenge or hearing challenge or speech challenge, how do you communicate with them? And then handling difficult situations. Sometimes patients are very demanding, or they are very anxious, or they are very, I know all kind. So how do you handle these situations? I have talked about it in depth in this book. So read this book. But I think the real learning will be in the program that we will interact. So the focus is, one is on the content. Second focus is on facilitation skills. So I would want you to keep a very, close eye on how I deliver the program. What pedagogies am I using in my session? How do I engage my audience? How do I create interest? How do I introduce my topic? How do I conclude the topic? How do I shift the topic? How do I handle, difficult questions? How do I handle difficult audiences? Because that's also another thing I'm sure you must be finding sometimes, when the audience is just not cooperating. They're not just ready to listen. And if I share my experience, I did around 500 training programs for government sector. I got this opportunity in 2014. So in government sector, when you go to deliver and nobody wants to listen, it becomes sometimes very challenging to make them sit and listen to you. Trust me, I literally went for Dale Carnegie's Train the Trainer program. In those days, I spent 45,000 rupees for just 3 days program to learn how do you handle these situations. which I'm going to impart with you. So the focus is also going to be on facilitation skills, because ultimately it's a master trainer program. So we have to learn, how do I facilitate a program successfully? And then, as I said earlier, also the pedagogies. We have to learn, just PPT is not enough. So when I asked, I sent you 2 questionnaires. One was brief introduction of the participant, and second one was pre-training assessment. I have read everybody's responses. Don't think that I just gave it and I didn't went through it. I went through every answer. I realized where you stand, where you want to be, what are your training needs, so that I can fulfill your requirement. And therefore, I have seen a lot of us are just comfortable with PPT. We don't know the other pedagogies. So it's going to be a rich learning experience in learning new pedagogies. So the format of the program is, the first 4 sessions I will be presenting. I will be talking about the topics in a while. The first 2 topics are, actually laying the foundation for all of us so that we all are on the same page. The first topic is going to be, what is the relevance of communication in healthcare, which we are going to cover today. The second topic again will be the nitty-gritties of communication, which will cover verbal and non-verbal communication. I'm sure many of you may be already knowing, but we will do it in an interesting way. So you will find new ideas. How do you go and implement this in your setup? After that, 2 sessions are going to be, focused on how do you go about designing a program, because that also has to be learned, discussed. And the 4th session is going to be on facilitation skills, where I will be talking about what is minimum requirement to be an excellent facilitator. So what all you need to integrate in your training so that you are able to confidently, successfully do a training program. And after topic 4 onwards, 5th onwards, all topics are clinical communication, which will be majorly on how do you manage patients' expectations, how do you resolve complaints, how do you handle uncooperative patient party, how will you handle aggressive patient party, breaking bad news. I think that's one of the very common challenge we all experience, or disclosure of medical error. For example, if I've given wrong medicine to the patient and I need to now tell to the patient that I'm sorry, I've given you this medicine. How do I go about doing it? And all these protocols we are going to learn not just by watching the PPT, but we will be doing a lot of role plays. We'll be taking case studies. We will be watching videos, and we all will be doing role plays and return role plays so that we learn from each other's experience. After session 4 onwards, I will be sharing a list of topics which will actually be about pedagogies. So I will be making a list of 15 pedagogies, or maybe a little more than 15. You can choose any one pedagogy. And then from session 5 onwards, you will have to make presentation for just 8 minutes. So for example, the list will have storytelling. How do you use storytelling in a program, or role play, or puzzles, or Kahoot, or anything that you are good at. Suppose if somebody says, I'm good at problem solving, techniques, using problem solving mechanism or techniques in training. So you can pick that up. And in those 8 to 10 minutes, you have to present, about that particular pedagogy. So if you say, I will talk about storytelling, then you have to give us a sample of storytelling, and then talk about how can you use storytelling, where all we can use it, what is the advantage or disadvantage, or what all do we keep in mind, do's and don'ts. I will share the instructions for that, but I'm just telling you from session 5 onwards, from 5 to 10. So that means last 6 sessions, in each session, we will have at least 2 to 3 presentations. So you can well imagine by the end of the program, we will have idea about almost 15 new pedagogies. That's the whole idea about the program. And of course, simultaneously, we will be covering these topics. I do not share the presentation. I would be running it for you. You will have the recording. You can always revisit the presentation, but I want you to make your own presentations. Because if you just copy my presentation and deliver, it will never have the heart and soul it should have. If the content is created by you, you will know it, that this is what I want to talk about, this key point. So I request all of you to read the material, to watch the videos, PPTs will be available on the video. You can visit and you can write your content the way you want to do it. But I will not be sharing any PPT with anybody. I hope that's okay with everyone. So any questions till now? I know we have spent 40 minutes. Normally this takes half an hour to 45 minutes for the introduction and overview of the program. Any questions about the list of topics or anything that you want to change or suggest that we don't want this, we want this?
No, doctor, I think.
Okay, thank you. Also, at the end of every session, I give a feedback form, which I normally post in the WhatsApp group. Within 24 hours, you have to submit your feedback. I request each one of you to give your feedback. It will not take more than 2 to 3 minutes. It's a very simple, very simple. And I read every feedback very carefully so that I can customize the program as per everybody's advice. So make sure that you give your feedback. I'm very open to taking feedback. I'll connect back to you to understand more in case if you don't like something or if you want to suggest something, I'll get back to you. I'll connect with you personally and find out what exactly are you looking for, and whatever I can integrate, I will definitely be happy to do it for all of you. Should we go further? Okay.
Yes.
Great. So today's topic of discussion is importance of communication in healthcare. What has changed in the last couple of decades that you think we need to talk about this topic? Because I know couple of decades ago, this was not there anywhere in the curriculum or even in discussion. What has changed in the last couple of decades? I request you to write in the chat box, because when you write in the chat box, everybody gets a chance. You can just write the keyword or whatever point you want to say. What do you think has changed in the couple of decades? Okay. Aparna says empathy. Empathy is lost, Aparna? Am I right? It's lost? Okay, accountability. Yes, thank you. What else? So now we are more accountable. I agree. What else? What do others say? Awareness, absolutely. Your patients are far more educated and aware of their rights. Absolutely. Social media. Yes, I again agree with you what you're saying. Consumer Protection Act, social media awareness among patients. Yes, Dr. Soma, I agree with you. We are aware that we are a part of service industry, so more competition. Yes. Trust me. So is this a desperate call, Dr. Abhishek? Or trust has gone down? That's what you want to say. Dr. Abhishek, you can unmute and answer.
Sorry, it was trust. The trust on doctors, I think, has gone down, and the various factors for that.
I agree. So that's what I said. You said, trust me. That means there's a desperate call. Please trust me.
It's just a typo.
Wonderful. So access to information and demanding patient. Yes, I completely agree. Then incorporation of integrity. Dr. Purnima, can you explain what exactly you want to say when you say this? So there's a need to integrate integrity. Dr. Purnima.
Ma'am, I was trying to unmute myself.
Okay.
So when I say incorporation of integrity, we just spoke a little bit in the government sector. And what should be driving us should go beyond the material benefits we get, or something which is tangible. So when we speak of integrity, it also involves the basic tenets of openness, accountability, honest communication, and empathy. So just to name a few. So yeah, doing our work with integrity woven into it, then definitely communication plays a very important role. Thank you.
Agreed. And that has changed. Need for that has really gone high, and we are still not ready for that kind of response to the requirement. I agree with you. Dr. Razak has written, health services are intangible and perishable, and the error occur in front of patient. It's a challenge. Yes, so that means now patients don't spare us. If there's a mistake, They don't spare us. They want us to, either compensate them for that, or at least say what has happened and why it has happened. Dr. Soma Ganesh has written more number of diseases about which even healthcare professionals are not aware of. Yes, I think that's also another, concern, that if we act as we don't know, then it becomes very challenging to hold the patient's trust in you. Negative publicity in media. Oh yes, I completely agree.
Ma'am, actually, I'd like to add. Ma'am, I'd like to add. Can I?
Sure.
Yes,
Yeah.
there's a huge difference between the public and private sector. So the expectations coming from a patient, so we are not able to meet. So that's a big issue because of the variety of reasons which my senior colleagues have pointed out here. So this disparity, especially because when I'm coming from here in Kerala, I can see that very well, because people are expecting too much and we are not able to deliver that much. So that is creating a ruckus everywhere, especially in my state. I can say that.
I completely agree with you. Ravinder has also mentioned something similar to what you are saying. Clinical competence is declining, and we are more dependent on investigations. So definitely patients' trust would definitely go down because they doubt our competency. I completely agree with you. Then emerging health insurance sector with need of transparency. Yes, absolutely. I think that's a very gray area, and that itself also causes a lot of strain and stress between healthcare providers. Time constraints. Yes, I agree. Then connection with the patient is less among healthcare professionals. Yes, there's a huge hue and cry about it, that we are not being treated as human being, and nobody's interacting with us, but they are interacting more with our reports and our findings. Absolutely. Knowledge explanation, absolutely another area. And AI, you have mentioned also, Simil, I agree with you. I think these are something that is not in our control, especially Google, the access to information, knowledge, which was always in medical books, very thick, very big, very complex, very difficult to understand. Now they are available in very simple and easy understandable manner, and sometimes not even authentic. The problem is not all information on Google is authentic, but people have access to it. They read it. They come with all those questions. How many of you are really comfortable when they ask you questions after reading Google? I want to ask the doctors. Abhishek, you are comfortable? You're okay with that? In the heart of your heart, you're okay, or you're okay because I have to be okay?
We have to give answers.
We have to.
Well, sometimes it's very foolish when it's Google doctors they're referring to, not actually authentic information, or WhatsApp doctors they're referring to. So yeah, I do find it a little funny, but there are many a times I'm surprised by the intelligent questions that people ask, which is good. I think provides a mirror to us doctors too, that we need not be thinking so sitting on such a big pedestal. Sometimes we can be
Don't
brought
consider your patient
down.
uneducated.
Yes. Yeah.
They are educated and they have access to information and they are intelligent.
Yes.
They are intelligent, and especially when they are paying, they want value for their money and they want accountability, like all of us are mentioning. So I think all these changes have really changed the picture of healthcare delivery system. I can see another response in the chat box. Like it or not, we have to accept it and face them to clear the myths and appreciate their knowledge. And I feel it facilitates ease of care. I completely agree with you, Dr. Soma. I think this is a barrier. If you are able to cross once, you are actually able to enjoy the availability of Google around you. I remember I was talking to one of very senior bariatric surgeon who is a friend of my husband. I mean, I started this video, YouTube channel by the name Master Stroke. So I interviewed him and I said, people are now going to Google. So how do you handle that? He said, I enjoy people who come with the Google knowledge, because when they have questions to ask, you know that you are interacting with somebody who wants to know about their illness. And second is, when I want to talk about the possibilities of complications or relapse, I tell them, I'm sure you must have seen Google and it is already there in the Google. So then I don't have to be, afraid of it, that I will be blamed for the relapse or the complication, but it's a documented thing. So they will know that it is not the doctor at fault, it is the body at probably, So it's a double-edged sword, I agree, but then at the same time, we have to be mentally ready for it. Like Dr. Soma says, like it or not, it is there, absolutely. And also I want to ask you, how many of you are using GPS? How many of you are using GPS for your travel? I use often. Even if I'm going to a regular place, I will always have my GPS on, because at least it will tell me if there is any kind of traffic block on the road. Google is like GPS for people. If we don't answer their question, they will definitely go to Google. If we can give them time and answer their question, trust me, they'll have more trust on you than they Google. But because nobody wants to answer their questions, nobody wants to talk to them, that is where they want to go and find out what is it, why is it, what is the outcome, what is the risk, what is the advantage. That's the thing. So we have to actually accept it, that this is here to stay. AI is also here to stay. Let me remind you, AI is also here to stay. So we have to be happy with that. Absolutely. So what do you think we need to really work on? What do we need to work on? Do we get ready for it or unhappy about it?
The communication with the patient and undivided attention to the patient is very important.
It's very important. At the same time, let me tell you, each one of us is responsible for our own communication with the patient, because a lot of time the aggressive reactions that come to us, they come to us individually. They don't come to the system. So we have to be careful for this, because when you communicate effectively with your patient, they develop rapport with you, they develop trust in you, and they are less likely to be aggressive with you. Lot of studies have shown that if you have been able to create familiarity with your patient, they are less likely to be aggressive with you. That's the benefit of actually communicating effectively. So let me show you a small presentation simultaneously and hold the discussion, and then a couple of activities also in the session. Give me a second. Yeah, this we have discussed. So we go further. So I hope my slide is visible to all of you. Is it visible?
Yes. Yes.
Okay. Thank you. So as I said earlier, practice was very, very easy and simple, but I think things have changed very drastically. Talking about the changes, I think most of the changes you have already talked about. They are more, aware. Their demands have gone up because they are paying. It is no more a free service. So definitely they want their value for money. Accountability and answerability as a result has gone up. Even aggression and stress has gone up. And it's not just the patients, even we are more aggressive and we are more stressful. As a result, the conflict rate has gone up. We all know. And we also know media is still not on our side very clearly. Chances of litigation have actually multiplied, and even the extent of fights where it used to be just verbal, now it has become actually physical. And let me also tell you here, you may be thinking that in India, probably we are more unsafe and we are at risk of violence. All across the world, healthcare professionals report almost 70% of them have experienced violence against them. So it is not just that patients are uneducated or misbehaved or demanding. Actually, the whole idea of disease and ill health is very stressful for anybody, and people reaction change to the situation. Even normal healthy people also become more aggressive and stressful, and they are more prone to becoming violent. So all these changes in the system bring us to a point where we need to sit and work on number of things, and I think one of them is our communication with the patient. And it is not just the doctor's communication. I think anybody and everybody who is handling patient, it is they who have to learn how do we effectively communicate with the patient, how do we address their concern, how do we handle their questions, how do we make them comfortable. Let's see what do studies suggest, because studies give us an idea of what the existing practice. You wouldn't be surprised to know that a study by Institute of Medicine has actually identified that our communication with the patient is often inadequate, because most of us lack adequate communication skill training. It's just recently in 2019, when the MCI revised the curriculum for the medical students, they have introduced a module called ATCOM module. That is attitude, ethics, and communication. Those who are into medical education, I think they will know, and they must already be doing it. But before that, I don't think anybody had any formal training in communication. Did anybody? Dr. Sambhaji, did you have any formal training in communication?
No, madam, no.
No, honestly not. Whatever you learned probably must have been by observing your seniors.
Yes.
If you had good seniors, if you had seniors who were well behaved, I'm sure you must have imbibed the same values. But we all know the number of good role models we have around us. So if you had good role model, I'm sure you must have picked up good things from them. But a lot of time we are not very mindful of the way we communicate. And as a result, our patients are not very happy with the way we communicate. Another study have shown that when they checked with orthopedic surgeon, 75% of them believed that they communicated effectively. But when their patients were asked, only 21% of the patients were happy with the communication they received. Even when it comes to informed decision making or consent taking or asking the patient what do you really want, most of our communication does not meet the basic standards of informed decision making. I remember I was taking a session for a group of anesthetists, and one of them said, ma'am, I had a patient who had to undergo a foot amputation. The patient was not very old, early 50s, you can say. She was high diabetic and she had to undergo foot amputation. She had come for PSC to him. In a very casual way, he said, I asked her, ma'am, kahan se pair katega aapka? Is it okay if I'm speaking in Hindi in between, or you want me to only use English? Anybody who's not comfortable with Hindi, please raise your hand. So in between, I do use Hindi when I talk like a patient, then I'm able to communicate better. So he asked this patient, from where are they going to, amputate? At what place are they going to amputate it? She said, पैर कटेगा? किसने बोला पैर कटेगा? मुझे तो नहीं बोला. मुझे तो ये बोला कि वो डॉक्टर है, उनको दिखा दो, और मैं आपको दिखाने आ गई. She thought that he's another doctor. This person is another doctor, so he has referred to him and he wants me to see him. That's all. Imagine you are planning to amputate. I know you will not amputate without taking consent and without telling, but you are planning to amputate and you have not informed patient. When you have decided to amputate, that means that's going to happen. What about patient's mental preparation? If you lose this small part of your finger, which doesn't contribute much in any day-to-day activity, it's disfigurement, it's a shock, and you're going to amputate somebody's foot. That person has to live with that disability, with that, that kind of condition, disfigurement, all his or her life. What about her movement? What about day-to-day activities? What about her social, interaction? So that's how sometimes we do not, communicate with the patient and give them a chance to talk and explain and understand. So those of us who are actually in favor of decision making, shared decision making or engaging the patient in decision making, they believe it can be done in every situation. But a lot of us still feel that shared decision making is not appropriate in every situation, and we are the one who should be deciding on the patient. If I may ask you, how far do you agree with this? That we should be deciding on the patient's behalf? No. How many of us push our decision to the patient? We have made up our mind and we push the patient. And if the patient does not agree, how do we feel? You know it better. A lot of time we are very unhappy when the patient does not agree to what we recommend. But patient's autonomy, it's realized the decision may be very much in the patient's benefit. But at the same time, if the patient is not ready, the patient has to be prepared for it. We can't be unhappy about it if the patient disagrees, especially if it's something serious. For example, foot amputation. Your patient might say that, sorry, I want to go and consult another doctor. And there's a doctor in Ayurveda, there's a homeopathic doctor, or there's a Pahalwan who would do this And how many of you get upset when they say this, there's a pahalwan and they apply oil and that, some dressing they do and the wound gets healed up. We may feel bad, but it's a very big decision. Patient will definitely be denying, will not agree. So we have to have a lot of patience to understand patient psychology here. And give that patient the opportunity to ask question. Again, sometimes they say, Doctor, homeopathy help karegi, Ayurveda help karega, and how do we react? How do we react when they say, Doctor, homeopathy le le? I've heard people saying, वो छोटी छोटी गोलियां क्या करेंगी, वो मीठी मीठी गोलियां क्या करेंगी, वो कुछ नहीं करेंगी. So again, that's a process. The whole shared decision making is a process, and many of us do not know. We don't even share everything with the patient. Am I right or wrong? By the way, why don't we share? What is the reservation? Can somebody try to answer? Why do we hesitate sharing all information? If you were a patient, would you like to be informed everything? So I sent a very close relative of mine to, again, that friend of my husband, who is by the way, my husband is an ophthalmologist. I think I should tell a little bit about me. So I sent my sister-in-law to him for bariatric surgery. She underwent, and she had a lot of comorbidities with this problem, and she underwent that surgery. Most of the comorbidities actually subsided because they were all related to obesity and other things. So, and she lost good amount of weight. And then when I asked her, "Are you happy?" She said, "I'm happy, but I have a couple of things that I'm feeling bad about." I said, "What?" She said, "I was never told that you will not be able to take an adult, quantity of food. Because we all know after bariatric surgery, you can just take almost 1/3 of what you normally eat." She said, "Anytime I eat little more, I throw. Why was I not told that you will not be able to take an adult-sized meal?" Then she had to take supplements for quite some time. And I don't know how many of you know, the cost of supplement is something like 5,000 to 8,000 rupees per month. Again, we don't inform all these things to the patient. So what I'm trying to say here, we don't practice shared decision making. We don't inform them everything. They feel bad. That's what patients are unhappy about. And you will agree with me that this is very common practice. You must be seeing this. Now I'm sharing this with you, a recent survey done in India this survey is done by ICC, CRMM, MAA, and Taragini, that says that 45% of the families and the patients reported that they had inadequate clarity on the diagnosis. They were receiving the treatment, but they were not clear for what they are receiving the treatment. There was lack of clarity on the treatment and care options. They didn't know what other options are available. They also felt that there was lack of involvement in deciding the treatment. So usually it was we who decided on their behalf and we said, this is what you need to go. And then also they felt the consultation was more like rushed one, where they were actually not engaged or involved, or their questions were not addressed. They felt unempowered in the treatment. The same study also showed almost 1/3 of the patients said that they were not even allowed to describe their condition or symptoms, the way they wanted to tell. And you will agree with me, a lot of us act very impatient when patients start talking about their disease condition, especially when the patients are elderly and they want to talk about their problem. We are very, uncomfortable spending more than the time that we have on our mind. So as a result, a lot of patients are not very happy with the way we allow them to speak. Almost the same number said the doctor did not straightforwardly address their questions, especially when they ask things like relapse, complications, disadvantages, options, financial implication. I don't think we are very comfortable talking about these things. And that's where they feel that their questions have not been adequately answered. Now, if I may ask you, if we communicated effectively with the patient, what do you think will be the benefit to us. But before we talk about how will this benefit the patient, I want to ask you, how are we going to be benefited if we communicated effectively with the patient? Write in the chat box. Trust, definitely. Definitely. Patient will be comfortable. Okay. It builds trust, absolutely. Duty well done, yes, absolutely. More clarity with respect to next plan of action from patient side also, absolutely. Both the parties will be more clear about what we are going to do. Then giving clarity of decision making to patients, preserved patient autonomy. Yes, I think both the things are looked after. They are engaged, they are clear, and also their autonomy is respected. Yes, I agree with you. Then patient find it easy to take decision. Obviously, if you're able to communicate to them, they find it at least, and even if you will talk about 4 options, if you have been able to win your patient's confidence, in the end, what normally they say? What do you get to hear? Very common one.
Suggest. You
Doctor
know
साहब,
best.
आप बताइए मेरे लिए क्या बेस्ट है. Doctor साहब, आप बताइए मेरे लिए क्या बेस्ट है. There was a time this used to come automatically, but now we have to earn it. It will not come automatically. They will keep doubting. Why are you asking me for surgery? Why are you asking me for this? Why should I get this test done? Now they doubt. And then comes a point where they are kind of relaxed and confident. Then they are talk, sab, aap bataiye mere liye kya best hai. But that does not come automatically. Now it has to be earned. Yes, there will be more cooperation, I agree. And all the negative outcome which can happen to the patient, they will be ready to accept. Obviously, if you have explained them about those possible complications, they will not say that, no, you have not explained. You have not talked to me. Especially, I tell doctors, when you are explaining them about the risk or complication or procedure or whatever you are talking about, draw on the case sheet where you take their consent on the same page. If you draw the procedure, if you explain them the risk, they can't deny that they were not explained. But then that has to be explained. That's the only way. There is no other way. So very, very clearly, if you are able to, communicate well, definitely patient will have more trust in you. They will agree with you easily. They will accept you, as their well-wisher. But at the same time, do you know, if you communicated effectively, not only with patient, because healthcare communication is not just with patient, with the fellow professionals also, it will actually bring down the medical errors. I don't know how many of you have idea about the number of errors that happen in healthcare industry. Can somebody guess? Can somebody guess the number of errors that happen in healthcare industry? Any estimates? Has anybody told? 1 in
4.
1 in 4. Okay. Okay. According to WHO,
10%.
Yeah, 1 in 10. 1 in 10 patient actually suffer some kind of harm because of us. How many of you have tried to calculate the number of errors that happen in your system? Harm or no harm, that is different. I had to give, a medicine. Instead of that, I gave B complex. So nothing, no harm to the patient. But it was an error. Try calculating, you'll be surprised to know. So a study by JCI that has shown that medical errors are third commonest cause of death in US. I repeat, medical errors are third commonest cause of death in US. We haven't done any study in India. I don't know if we did where we will stand. You can tell me better. According to their estimates, 250,000 patients die every year because of the medical errors that happen in patient care. A country that's working so meticulously, that's their estimate. You can well imagine what must be happening in our country. This is a study done by Professor Ashish Jha from Harvard University. He estimated 5.2 million medical errors happening annually in India. I feel it is underestimation. It must be much more than that, because usually we do not report that the errors that happen in patient care. And I think you will agree with me.
I'm totally agreed.
Absolutely. Absolutely. So medical errors like wrong site surgery, wrong medication, wrong organ removal, wrong treatment, wrong patient, these are very common. Studies suggest it is safer to work in nuclear industry or to work in aviation industry than to actually get admitted into any healthcare delivery system. 1:33,000 errors. I'm just giving you an estimate to help you understand the number of errors that are happening right under your nose. You may not be even knowing. And most of the errors are around medication error and patient care error. Of course, surgical errors we have seen, and of course, patient getting infected. And 60 to 70% of these errors are because of poor communication or communication failure. Let's do a small activity. I'm going to put 5 of you in the waiting area, and I'll be bringing you back one by one. So I'm not picking anybody, but whoever name comes in the list on top, I'll be sending 5 of you to the waiting area, and I'll bring you back. So Dr. Abhishek, your name comes on the top. I'm sending you to the waiting area. Okay. Anandita, your name is second. Yes. I'm sending you to waiting room. Then it is Dr. Anu. Okay. Dr. Anu, I'm putting you to the waiting room. Dr. Razak, I'm putting you to the waiting room. And then Aparna. Okay. Okay. So there are 5 people in the waiting room now. I'm going to show one slide which will be visible to all of you, but I want to, pick one person who will be the first one to work on. So Dr. Purnima, I take you as the first thing. I'm showing a slide which will be visible to all others. All of you kindly observe the whole activity. Note down whatever you observe. I will be asking you to give your feedback. And Dr. Purnima, once you have read that, you let me know that I've read the slide. I'm showing it. Give me a second to show the slide. Okay. So is this slide visible, Dr. Purnima?
Yes, ma'am.
Let me know once you have read it.
Okay, ma'am. I'm done reading it, ma'am.
Thank you. So now I'm going to get one person from the waiting area. Whatever you have understood, you have to explain in your words. So let me go to the waiting room and bring one person. Okay, so I'm getting Dr. Anu. I'll just explain her, and then you need to explain in your words. So Dr. Anu, are you there? Dr. Anu, are you there?
Yeah, I'm here.
Yeah. So Dr. Anu, Dr. Purnima has a set of information. She's going to share with you. Please listen to her carefully.
Okay.
Okay. Yes, Dr. Purnima, please go ahead.
Here I am relaying to you the information that we were just shown. This is about a patient who is a 21-year-old male admitted on bed number 1 in ICU and underwent surgery under Dr. Shetty, a cardiovascular surgeon, who removed a calcified tumor at the junction of the third and the fourth rib. And in the evening of the first postoperative day, the patient complained of pain and numbness at that area. And telephonically, Dr. Shetty advised that a neurologist opinion was to be sought.
Dr. Anu, is that okay?
Yes, ma'am. Okay.
Okay, great. So I'm admitting the next person. Now you will be sharing this information with the next person. So I'm admitting Dr. Abhishek. Dr. Abhishek. Dr. Anu has a set of information she's going to share with you. Please listen to her carefully. Dr. Anu, go ahead, please.
Okay, I may be missing because I didn't record anything, but still I'll try to give information. I know that I'm going to deliver only 10%, but still it's a try. Okay, Dr. Abhishek, it's a case of 21-year male patient who is admitted in the surgery ward. It was seen by Dr. Shetty. There was some surgery happened in between third and the fourth rib, and he was kept under observation. This is what I got it. That's it. Because
Dr. Abhishek, is that okay?
Yeah.
So you have understood whatever she said? Okay. So I'm admitting Dr. Razak. You have to explain in your words to Dr. Razak whatever you have understood. Dr. Razak, Dr. Abhishek is going to share a set of information with you. Please listen to him carefully. Dr. Abhishek, please go ahead.
A 21-year-old male patient has been admitted in the surgical ward. He is to be performed a surgery by Dr. Shetty, and the surgery is involving or around third and fourth rib.
Third and
which side?
Sorry?
21-year-old male patient
Yes.
has been admitted in the surgical ward for some surgery. Surgery is to be performed by Dr. Shetty. The surgery is involving or around third and fourth rib. I don't know which side. This is the information I have.
So Dr. Razak, is that okay? Have you understood?
I have. Yes, I have.
Okay. So I'm admitting Aparna. You have to pass on this information to Aparna.
Yes. At
Let her
20.
come. 1 second. Dr. Razak, hold on. Aparna. Yeah. So Dr. Razak has a set of information he's going to share with you. Please listen to him carefully. Yes, Dr. Razak, please go ahead.
Yes, a 21 years old male come to the hospital in surgery department, and we'll have a surgery. Surgery will be done by Dr. Shetty, and the area is by cutting the third and fourth rib area.
Aparna, is that okay?
So I want to know how many year old male? Sorry, I didn't get that.
21 years.
21. Okay. And he's going to undergo surgery for third and fourth?
Dr. Shetty. Dr. Shetty, and actually the place is third and fourth rib.
Okay.
Aparna, is that okay?
Yeah.
Okay. So I'm admitting Anandita. I request you to explain to her whatever you have understood. Let me first tell her once. Huh? Anandita?
Yes.
Okay. So Anandita, Aparna has a set of information she's going to share with you. Please listen to her carefully. Aparna,
Okay.
yeah.
Okay. So a 21-year-old male has come for a surgery under Dr. Shetty for third and
Pardon?
fourth rib.
Pardon? Under?
Under Dr. Shetty
Okay.
to get operated for third and fourth rib.
Third and fourth?
Rib.
Okay.
So Anandita, is it clear?
Yes.
Okay, great. So can you explain in your words whatever you understood to everyone?
On 21st, a male patient had come for a surgery to Dr. Shetty for his third and fourth rib.
On 21st?
Yes.
What has happened on 21st?
So a male patient,
Mm-hmm. Mm-hmm.
had come for a surgery to Dr. Shetty for his third and fourth rib.
Thank you, Anandita. Thank you.
Welcome.
So friends, first of all, those who were observers, you must be really amused with the whole activity. But anyone who would have been in their place would have done the same thing. So please do not think that those who did the activity, they don't know, or they didn't communicate well. We could have communicated better. So pardon me, those who were put out, and I mean, just to demonstrate. But first, I want to know from those who were observing what exactly happened, what all changed, and give 1.1%. Don't give all the points. Give 1.1% so that everybody can contribute. What do you think happened, Ravinder?
It was like when the message is passed on from one person to another person, certain message was missed at each step.
One information got changed. Just tell that. What happened? Like, for example, name got lost.
Yeah, 21.
Name got lost. Thank you. One.
Yeah, one is the post-op patient became pre-op patient.
Okay, hold on. Post-op patient became pre-op. Dr. Soma Ganesh, tell me please, what happened?
21-year-old male has become an 21st day of surgery.
Wonderful. Mr. Vijay Rai, what happened? Unmute, sir. Please unmute your device.
The entire communication was
Tell one
bungled.
thing. I know the whole communication got completely messed up. Can you specifically say, like they said, 21-year-old boy became 21st?
Yeah, the first, second.
Not your fault. Don't worry, not your fault. Yes.
The tumor had to be removed between the third and fourth rib. That was not mentioned. It's an error.
It became a prospective surgery. Yes, Dr.
Yes.
Joy, what do you say?
Yes, ma'am. Actually, it was a complaint post surgery. Patient was complaining regarding numbness.
Yes.
So now it has become after fifth person became he was posted for surgery, something like that. It came out to be.
Yeah. Jana has written ICU became surgical ward. Yes. And it is one surgery. I completely agree. So I think the first thing that we lost in the process was the neurologist had to be communicated or connected on urgent basis. Name, of course, we normally don't talk of name. We normally say bed number 6 पर ये देख लो, bed number 4 पर ये है, ICU number 1 में ये है. Do we talk like this or not? We don't use names. Then we communicate what we have understood, not the fact, but what we have understood, which could be very different from the actual fact. We lost the name. We lost that it needs to be attended urgently. Neurologists had to be communicated. I think that information got completely lost, I think, right in the early communication somewhere. And then what was this surgery? Because the name is complicated. So that idea that I have to talk about that, that surgery, there's a calcified tumor removed between the third and fourth rib. It's a difficult term. So we forget, or we don't say because we sometimes don't know how to pronounce, so we miss that. In healthcare, this is happening every day. And friends, what I shared with you is a real life case. Do you know what happened in that case? What do you think would have happened? Yes? What do you think would have happened?
Wrong surgery.
सर्जरी तो अपर्णा पहले हो गई थी. सर्जरी
They
तो
didn't inform it to neurologist.
Sorry?
They didn't inform it to neurologist about the numbness. So they have missed. So maybe he landed into some stroke.
Can you believe what happened? See the outcome. And you'll be surprised and shocked. But I'm sure we are seeing this happen every day. How many of us really take that seriously? That's a thing to be asked. You know what happened after this? No, first of all, those who were out to read this. Aparna, you were out. Anandita, you were out. Anu, you were out. So please have a look at the information. This was the information shown to Dr. Purnima. Read? Okay. And you know what happened? The seriousness of the situation got lost as the information got corrupted. Neurologists came to see the patient only after 16 hours on the next day. And the patient suffered irreversible paraplegia. And you know the age of the boy? I think many of us have children in the same age group. So you can well imagine what must have been the plight of the patient and their family. And in these situations, if they become violent and aggressive, and we blame them that you are demanding and you are over demanding, pardon me, they are not demanding, we are not responsible. I shared this real life case to help you understand. We say patients do not know how to communicate. In this example, we are all healthcare professionals communicating information, and you can see how the whole information got completely modified. Health handout, patient handing over tool I'm talking about, handoff. Handoff is considered Bermuda Triangle of healthcare. 60 to 70% of the information is lost during transition of care, especially when the patient is being handed over from one care provider to another. It could be between the nurses, it could be from one care area to another, it could be from one specialist to another, it could be from one hospital to another, it could be from one department to another. That's where most of the information gets lost. And somebody pointed out it was one-way communication. Even when you all were communicating, I gave you a chance to ask, and I asked, are you okay? None of you said, no, this information is not making sense. What do I do with this? Doesn't look complete. Nobody tried to note down. If somebody had tried to note down, probably you would have immediately, kind of clarified what exactly we mean by this. And that's the challenge in healthcare, and that's the reason why we are facing these kind of errors, because most of us are not coordinating with our other team members. How many of you talk to your dietitian and talk about your patient's diet? How many of you sit and discuss your patient's case with physiotherapist and see what physiotherapy the patient requires? How many of you speak to your counselor or psychologist and talk about the patient's mental health concerns if any patient is appearing more anxious or panicking or depressed or paranoid? I doubt. We are all working in silos. I'm physician, so I look after only hypertension, blood pressure. I'm orthopedician, I look after only bones and muscles. I'm neurologist, so I look up. This is how we are working. And that is why the patient feels at lost. I'm nobody's. I'm everybody's and I'm nobody's. So if we communicate it effectively, I think there will be better coordination between us and our team members. Doctors, nurses, senior doctors, junior doctors, nurses, healthcare providers, everybody has to be ultimately taken as a part of the team. There will be better communication, patient safety will be looked after, continuity of care will be ensured if you communicate it well. Also, let me also tell you, there are a lot of intense communication that we have to do with the patient and the family. For example, end of life care, breaking of bad news, grief counseling, disclosure of medical error, some complication. These are very sensitive communication. Again, I doubt if anyone has any formal training in this, but everybody is trying to try their hands the way they can. And as a result, most of the patients are very dissatisfied. Almost 2/3 of the patient and the family say that it was a suboptimal experience. Either they find the physician to be too blunt or being insensitive or giving a feeling that there's no hope. What they want is balance between sensitivity and honesty. Yes, we have to tell the truth. We can't be lying. We can't give them unrealistic hopes. But at the same time, we need to be sensitive. We need to be understanding that this is going to come as a shock to the patient and family, and they'll take time to absorb. But unfortunately, we are not kind of trained to handle those situations. So, and we'll be talking this in detail towards the end of the program when we talk about breaking of bad news and disclosure of medical error. I'll be sharing you a lot of studies that will tell us what is the existing practice. If we communicate it effectively, even the allegation of medical negligence will go down. Studies have shown that in almost 71% of the cases where the patients have sued the hospital or the doctors for medical negligence, the problem was not medical negligence. Problem was communication failure, miscommunication or missed communication. Even the violence would go down if we communicated well. Studies show if you communicate well with your patient, if you create familiarity, if you create that trust, there is the risk of violence will go down. Of course, the conflict with your own team member also would be less if you had good work environment where you treated your team members and subordinates with respect. Everybody has a role to play in this system, and every role is important. But a lot of time, we go by hierarchy and we do not care for people down the ladder. And that's where they go into Cold War or they are uncooperative with us. So if we create good work environment where we respect each member and we appreciate and acknowledge their contribution, I think each one of us will enjoy professional satisfaction. And it's important for all of us. Now, if I may ask you, how do you think the patients will be benefited if we communicated well with them? Write in the chat box. If we communicated with our patients, how will our patients be benefited? What will happen? Clarity, okay, agreed. Better quality of care and continuity of care. Informed decision making. Patient will be more satisfied, absolutely. Patient satisfaction, yes, true. Blind trust. Patient will have trust. I don't want them to have blind trust. We should not have blind trust on anybody. But yes, we need to have trust to develop that therapeutic relationship. Then of course, multidisciplinary plan of care would work very well. It will, okay, valued, yes, efforts will be valued. Will feel free to ask questions and be more cooperative, yes, because they are comfortable, they can clarify things, so definitely they'll be happy. Enhanced image of healthcare organization, reduce hospital stay, yes, I think that's a wonderful point what you're mentioning. Simil, am I calling it right? Simil, okay. Simil, अपने नाम पे अपना login करोगे तो अपने नाम से करो, because
Yes.
it will take a couple of sessions to remember the name.
Yes.
Yeah. Then acceptance of outcome and facilitate healing faster. Absolutely. An image of the hospital. Absolutely. Although the question was, how will the patient be benefited? But many of you have mentioned they'll be happy, they'll be satisfied. Do you know it can change the outcome? Has anybody ever tried to do any study to check the outcome? I mean, one set of patients who were not communicated well and one set of patients who were communicated well. Is there any difference in the outcome? Fast recovery. You know, studies have shown where the patients had good communication coming from their healthcare provider, they actually improved faster. Multiple studies have shown they had better pain control and they had improved response to pain management modalities. Even chronic conditions like diabetes, glaucoma, high cholesterol, hypertension, even these diseases responded better to the treatment when the healthcare providers communicated effectively with them. Even in cardiac surgeries, studies have shown improved outcome and also decrease in the post-operative complications such as cardiac arrhythmias. Not one, number of studies have shown this. Why do you think this improved outcome? Can you guess? Can somebody guess why there is improved outcome?
Because of improved communication to the patient.
Wonderful. And
they
what
have better understanding of their disease and how to manage it and what precautions to be taken.
Absolutely. When they know what is their role, how are they going to participate? What is their responsibility? Why they need to take medicine properly? Why should they control their diet? Why should they exercise? Why should they come for follow-up? Why this medicine is important to be taken on regular basis or at that particular time? When they understand, their compliance improve. And their compliance will improve, automatically the outcome will improve. Of course, all this will also give them satisfaction that they are in safe hands. Their doctors and their nurses and their, the whole team is helpful, kind, compassionate. The moment you are in a safe place, your body starts healing itself because we release a set of hormones that improve our resilience, that improves our healing, because you feel relaxed, you are comfortable, you are cheerful, you are happy, you are feeling safe and secure. That's how we can improve our patients' outcome. And how do you think the organizations will be benefited if we communicated well? What will happen?
The image of the organization will be enhanced.
Absolutely, absolutely. Today, people read your Google reviews before they come to you.
Yes.
And incidentally, people don't go and write good reviews if they're very happy, but they don't hesitate writing poor reviews if they're very unhappy. So if there is no poor review for you, that also is a good review. So it's very important to remember people actually go to Google to see your performance. But organizations which have good culture, where we all communicate well with each other and also with the patient, it will definitely, first of all, enhance the safety and quality practices. Also, the environment is good. I know there are hospitals where we go and come back very unhappy. What is this? It's a chaos. There are hospitals where you go and come back. What a nice hospital. How good people are, very helpful. So it's the environment that you create. Of course, anybody who will work there, they'll enjoy greater job satisfaction. Also, patients will give you good, scores or feedback. Not only this, they will come back to you. They'll also recommend to others. So it's not just for the patient that we need to communicate. It's for us and for our organization. And of course, for the patient, we need to communicate effectively. And it's not just one person. It's a team effort. Everybody and anybody and everybody who is handling patient needs to learn how to communicate effectively. So the last slide is, in nutshell, communication in healthcare is not just about niceties. It is the therapeutic communication that happens between you and your patient. It is the clinical communication between you and your team members. It is part and parcel of the treatment. It is not optional. Not that if I want, I will communicate. We all have to learn to communicate in a professional manner. Of course, if we communicate it effectively, it will have direct impact on the continuity of care, patient safety, and treatment outcome. There are so many communication protocols that every healthcare professional must know, learn, and practice. We are going to pick up some of them when we will be in the future session. But then, and there are multiple ways also to learn and implement these skills. So I think training in healthcare communication is not optional now. It is something that we all have to make mandatory for our healthcare providers. Everybody should learn. It should be part and parcel of the induction program in every organization. Like we talk about biomedical phase, like we talk about medical legal implication, like we talk about some of the important topics, I think communication should be part and parcel of the induction program. So with this, we come to the end of session 1. Questions, if any, for whatever we have discussed or whatever points you wish to raise here at this point.
So I have a question. Till now, we have been discussing about the patient and the doctor and how effectively. What are the benefits? What if we don't use the proper communication? So these all things we have been discussing. Since I am into the administration part, and I think communication has to be proper and effective at every, across all departments of the hospital, right? For a smooth selling. So I believe, as we go forward, you will also give us some insights on how to improve the communication for whoever is working in the healthcare industry.
So Anandita, principle of communication remains, universal, and not only in healthcare setup. I think what I talked, if you will apply even in your, back home, it's equal. It's same. So whatever we are going to discuss, it's actually equally applicable in all spheres of life. That is one thing.
Yeah.
Second is when we take case studies or role plays, you can bring up a situation from your work area.
Yes. Okay. Fine.
You can be ready with one situation that this is the situation I want to. For example, how do you handle uncooperative patient? We could take how do you handle uncooperative employee? You could do a role play. So please bring in your situations which you think you want to be discussed in the role play, in the case study, and we can talk.
Okay.
Although primarily it is not a program on management.
Yeah,
I hope you understand. But then at the same time, I'll try to cater as many situations as possible, because it's going to enrich all of our learning. Because personal management everybody is doing. Everybody has a team, and everybody should learn how to handle their team members. That's equally important.
Okay.
Thank you for
Thank
bringing
you.
it up.
Thank you.
Thank you. Any other question?
Please, I have a question.
Yes, please.
Actually, when the errors or any event which is not wanted happen to any hospital, then unwanted situation can be happen, and there can be a mob. There can be a mob. When there is a mob, and I have to control the mob, then how will you communicate with the situation? I think I can. I mean, usually I then pick up some of the important figure from the mob or any legal guardian of the patient, to whom the bad event occurs, and then try to explain to the situation, and try to be honest to the whole situation, and that's my actually strategy. Please, if you can help me, not today, if in future,
So Dr. Razak, that is one of the topic we are going to cover, handling aggressive patient parting.
Okay.
That's one of the topic we'll be discussing, in depth. We'll be doing a role play, and we will be, but before that, we will be talking about assertive communication. That is, what is the right way of communicating in these situations where you don't, bow down, but at the same time, you're not aggressive or you're not, intimidating. Because a lot of time we become aggressive, and that instigates them and also makes them, react with aggression. So we will be not only, I'll be giving you a questionnaire which will help you to know your communication style. That is one thing. And then what is the right way of communication, that also we will be discussing. And then we will be doing role play also around those situations where the patient party will act. I mean, one or two of you will become patient party and you will act aggressive, and somebody will have to role play how do you handle it. And I will also be sharing the protocol, some guidelines that will help you, which you can implement in your system. Like, for example, identifying red flags. So violence does not happen all of a sudden. There are always red flags. Have we trained our people to identify those red flags? If my team knows that this is a situation which is very volatile and this can turn into an aggressive, mob attack, then proactively I need to mitigate that situation rather than waiting for something big to happen and then I react. Then it is just firefighting, nothing else. Then you will be actually under, kind of pressure, and you will also be like trying to just see how you can control the situation, crisis management. But proactively, like if you can identify that these are the situations, like I was talking to my daughter who is in US, I asked her that how do you handle people who are very aggressive, or she said, we do disc analysis. I don't know how many of you have heard that word. It is DISC. It's a disc analysis. Those who are into training, they may be knowing it. So it's more like, knowing about the personality of a person. It's a very elaborate test. I said, how is it possible to do disc analysis for every patient? She said, no, we don't give any paper and pen and questionnaire to the patient, but anybody who is the first one to get in touch with the patient, and which is usually the front desk person, who would be actually interacting with the patient. And in that interaction, 5, 10, 15 minutes of interaction, that person is able to identify the personality type. And on the corner of the case sheet, we write that this patient handle with care, kind of a thing. And then everybody who is in touch with the patient will know that I have to handle this patient with care. So there are so many ways we can actually, integrate in our system. We'll be talking about that at length when we will come to that point. But I think your concern is very right, because you are in a medical college and a hospital. So obviously you must be facing this situation every day, and especially government setup, we know how patients and families behave. But I hope this program will help you in creating that kind of setup in your system, not just learning, but also creating that kind of system in your system. Thank you. Thank you. Any question or anything somebody wants to say or comment? Dr. Sambaji, you have been very quiet. What's your comment or feedback or question?
Basically, communication has to be proper, and before that, there has to be proper listening. We need to listen properly first. Then only we will be able to communicate. Then we will be able to answer the questions.
Excellent. So you have demonstrated very well active listening. Yeah. And we will be doing a lot of activities in the next session about these skills, what you said, active listening, and other aspects also. I will not reveal now, otherwise you will lose the interest, but then you will get to enjoy learning through activities. It's not funny, but it is fun way of learning. We will be. So since we have 5 minutes time, I'm sharing the feedback form in the chat box. So I request you to complete this now itself rather than postponing it to tomorrow. And in case if meanwhile have anybody some question, you can please ask or say, or any comment you wish to make. I mean, you feel free to. It's taking a second to open, so give me a moment. Yeah, I'm sharing the link in the chat box. Yeah. I've received 9 responses. I'm waiting for others to complete before we close. So we will continue with Wednesdays, 8 to 10. I hope that's okay for everyone.
Yes.
Yeah.
Thank you.
Okay.
Once in a week, ma'am?
Yeah, once in a week. Once in. Otherwise, twice in a week, it's not convenient even to the participants because it takes away a lot of their time. Plus, I have other engagements also. So once in a week is.
Thank you, ma'am.
Thank you.
Thank you. Thank you so much.
Responses, 2 more people to respond. Can you raise your hand if you're still doing it? I'll share the feedback form in the WhatsApp group also, in case if some of you are still to give. So thank you so much.
Thank you.
Thank you.
Thank you very much from Bangladesh.
Thank you, Dr.
Good night.
Thank you so much.
Thank you. Good night.
Thank you, Dr. Indu. Thank you very much.
Thank you for attending this at these late hours. I know it's not easy to stay awake till so long, and especially after a day long. Thank you. Thank you once again.
Thank you.